Namaste Bitya, Hamesha Khush Raho Bitya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH-FHS University, Jain. In today's lecture, we are going to discuss about the various radiological investigations that we can do in the cases of neurological examination. What are the various radiological investigations that could be done for the diagnosis of the cases, especially of neurological origin? Starting from the very basic, we will start with the skull X-ray. This is the most commonly done and most simple investigation that could be done for the diagnosis of neurological disorders. Plain X-ray should not be done routinely, but the diagnostic importance of the changes that are seen are plain X-ray skull is done in cases of fractures and lesions of the vault or base of the skull. So if you want to see for the fractures or you want to check for the lesions of the vault or base of the skull, example metastasis, then this has to be done. In case of enlargement or the destruction of the pituitary fossa, called the sella turcica, example in cases of pituitary tumors, raised intracranial tumors, radiological X-ray skull can be done. So in case of fractures and lesions of the vault of base or skull, example in case of metastasis, enlargement or the destruction of the pituitary fossa, called the sella turcica, example pituitary tumors, raised intracranial pressure. In cases of intracranial calcification, example tuberculinoma, cysticercosis, oligodendroglioma, wall of aneurysm, X-ray of the skull can be done. In case of pineal calcification, to show any kind of midline shift, this can be done. Spinal X-rays can be taken when there is to show the fractures and degenerative or destructive or congenital bone lesions. Chest X-rays, these may show bronchial carcinoma, spinal or rib lesion and thymoma. Various imaging techniques like computerized tomography. This is becoming more and more common these days for any kind of neurological lesion. CT of brain, computed tomography, or it is also known as the computerized tomography. The difference is CT attenuation between bone, brain and CSF makes it possible to distinguish the normal and infarcted tissue, that is hypodense tumor, extravasate blood, that is hyperdense and edema. So CT can be done for differentiation of various lesions in bone, brain and CSF to distinguish normal and infarcted tissue, tumors, extravasated blood and edema. MRI is another important investigation, radiological investigation that could be done. Magnetic resonance imaging. MRI scan can distinguish between white matter and gray matter in the brain. Brain tumors or space occupying lesion, that is called as SOL. Space occupying lesion, these could be seen in the MRI. So MRI can distinguish between white and gray matter in the brain, and brain tumors or the SOL, that is space occupying lesion. Another important radiological investigation consists of cerebral angiography or magnetic resonance angiography, digital imaging. These demonstrates the cerebral, arterial and venous systems. So we have CT scan, we have MRI and we have cerebral angiography or MR angiography. Next important investigation is myelography. Myelography is basically a water-soluble contrast media is injected intrathecally into the subarachnoid space and viewed by conventional X-rays or CT. So what we are doing in myelography is water-soluble contrast media is injected intrathecally into the subarachnoid space and it is viewed by conventional X-rays or CT. Another important method is isotope brain and bone scanning. So what happens in isotope brain and bone scanning is a radioisotope, that is 99 technetium per technate, is injected intravenously to detect any kind of vascular tumors, atrioventricular malformations, cerebral infarcts and subdural hematoma. That is isotope brain. When you are using an isotope, radioactive isotope, here 99 technetium per technique, it is injected intravenously to detect vascular tumor, any kind of vascular tumors, AV malformations, cerebral infarct, and subdural hematoma. I will again repeat all these methods. First of all, we have discussed about the X-ray, plain X-ray of the skull, especially in case of fractures, enlargement or destruction of pituitary fossa, intracranial calcification, medial calcification, various kind of spinal X-rays for fractures, degenerative, destructive, and congenital bone lesions, chest X-rays to check for bronchial carcinoma, spine and rib lesions, thymoma. Imaging like CT scan, the difference between CT attenuation to differentiate between bone, brain, and CSF attenuations, and to distinguish between normal and infarcted tissue, tumor, extravasate bone, and edema. MRI, another important investigations to distinguish gray and white matter and to check for any kind of bony tumors and as well space of spine lesion. To check for cerebral angiography or magnetic resonance angiography. Myelography, where water soluble contrast media is injected intrathecally into the subarachnoid space and is seen under conventional X-rays. And the last one is isotope brain bone scanning by technetium 99. When it is injected in the blood to see for vascular tumors, AV malformations, cerebral infarct, and subdural hematoma. So this was all about the radiological investigations in case of neurological disorder. In the next lecture, we are going to discuss about various electrophysiological tests that could be done in case of neurological diseases. So this was all for today. This session was powered by digital version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.